Brain injuries can be classified as direct or indirect. Direct injuries can occur in open head injuries when the brain is lacerated, punctured, or bruised by broken bones or by foreign objects. Indirect injuries may occur with either closed or open head injuries. In an indirect injury, the shock of impact on the skull is transferred to the brain. Indirect injuries to the brain include concussions and contusions. You should assume skull or brain injury when the mechanism or location of the injury may indicate it, since they are difficult to recognize. Visible bone fragments and bits of brain tissue, a deep laceration or severe bruise, or hematoma to the scalp or forehead are the most obvious signs of skull fracture. However, most skull fractures do not produce these signs. Check for altered mental status using the AVPU scale: alert, verbal stimulus, painful stimulus, unresponsive. Pain may range from a headache to severe discomfort. Also check for irregular breathing patterns, temperature increase, blurred or multiple image vision in one or both eyes, impaired hearing or ringing in the ears, equilibrium problems. The patient may be unable to stand still with eyes closed or may stumble when attempting to walk. Do not test for this. If the patient is alert, check for orientation to person, place, and time. Pupils unequal or unreactive to light. One eye appears sunken. Bleeding from the ears or clear fluid flowing from the ears and/or nose. Late signs include Battle's sign, a bruise behind the ear, raccoon eyes, black eyes or discoloration of the soft tissues under both eyes, paralysis or disability on one side of the body, or seizures. Brain injury may also show personality change, ranging from irritable to irrational behavior, a major sign. Posturing. These postures may be assumed spontaneously or in response to a painful stimulus. Decorticate posture, flexed arms and wrists, extended legs and feet. Decerebrate posture, extended arms with the shoulders rotated inward, wrist flexed, legs extended. Paralysis or disability on one side of the body, or seizures. A contusion is caused when the brain hits the inside of the skull, bounces off the opposite side, and then rebounds to strike the first side of the skull again. Such an injury could result in a hematoma. A hematoma is a collection of blood within tissue. A subdural hematoma is a collection of blood between the brain and the dura. An epidural hematoma is blood between the dura and the skull. An intracerebral hematoma occurs when blood pools within the brain. There is limited room for expansion inside the skull. When a hematoma develops, pressure inside the skull increases, making it difficult for blood flow to enter the head. As a result, the brain becomes starved for oxygen and high in carbon dioxide waste, which causes more swelling. This can lead to decreased respiratory effort, further worsening the oxygen starvation and swelling, eventually leading to death.